Good afternoon, and thank you for joining us for our weekly update, even though we haven't been in 2 weeks. I'm pleased, as always, to be joined by Dr. Lawrence Lowe, our Public Officer of Health, Medical Officer of Health here at the Region of Peel, and today with Sam Rogers, who is the City of Mississauga's Director of Enforcement. I first want to wish all Mississaugans a very happy New Year. I know that so many people weren't able to spend the holidays with their loved ones this year, and I know how hard that is. I want to thank everyone who listened to the advice of public health and kept their celebrations to the bare minimum, to their immediate families. It was a huge ask, and I'm so truly grateful to so many people for the sacrifices that they made. I also want to express my deepest condolences to the family of Maureen Ambersley. Maureen was a nurse at one of Mississauga's long-term care homes, and she has sadly and recently passed away from COVID-19. I want to thank Maureen for her many years of dedication and service to our community. Her passing is an important reminder of the huge personal sacrifices that our frontline healthcare workers, they're our heroes, take each and every day to provide care to the most vulnerable in our community. The COVID-19 situation facing Mississauga and Peel region remains extremely serious. While our case numbers in Mississauga have been plateauing for 6 weeks, we have seen some incredibly high case counts of recent days, including some single-day records. Mississauga is currently averaging 163 cases per 100,000, with Peel region as a whole averaging 211 cases per 100,000. If we are going to see a surge in cases soon from the holiday gatherings, and that will bear out in our numbers over the coming weeks. But as I've said many times here before, it's not our continued daily high case numbers that concern me the most. It's the situation in our hospitals. Right now, Mississauga Trillium Health Partners is dealing with 135 COVID inpatients, 31 in critical care, and approximately 70 more suspected cases. And that, of course, means that more than 230 rooms at Trillium Health Partners are being used solely for COVID-related patients. 51 staff are also off due to COVID, and THP is seeing staffing shortages across the entire hospital system. Over the last month and a half, more than 100 Trillium patients have been sent to other hospitals across the GTHA. I'd like to thank Halton Healthcare, as well as hospitals across Toronto, for supporting Trillium Healthcare. The reality is that Trillium is functioning at about 77% of their surgical capacity, and there is concern that they will have to reduce even more so. Brampton's William Osler is currently at 43% of their surgical capacity and have 110 COVID patients, 13 in the ICU, and another 64 suspected cases. The promising news is that there are many on our frontline healthcare workers who have already received the vaccine and have begun to make headway in our long-term care homes. On December 30th, I joined Trillium CEO Michelle DeManuel, Premier Ford, and Dr. Lowe to receive the first shipment of Moderna vaccine that arrived in our region. So far, Trillium has vaccinated 2,600 frontline healthcare workers. And Peel Public Health has vaccinated almost 1,000 long-term care residents, their staff, and essential caregivers. I'm also encouraged that the province announced yesterday that it plans to have all long-term care residents, healthcare workers, and essential workers vaccinated by January 21st. I'm urging all frontline healthcare workers who have not been vaccinated to please go and get their vaccine at either Trillium Health Partners or William Osler. Both hospitals have the capacity right now to administer the vaccine, so please do not hesitate to go and get it. Doing so will help limit further spread in our hospitals and in our long-term care homes. On that note, I want to acknowledge the incredible work that our hospitals are undertaking right now. They're being asked to treat COVID patients, administer tests, vaccinate frontline healthcare workers, and provide their regular inpatient and emergency care. Our hospitals have once again stepped up on so many different fronts. The more we come together as a community to reduce the spread of the virus, the more pressure is taken off hospitals. That means hospitals will be able to put more energy and resources into vaccinations and providing necessary treatments and surgeries for their patients. I want to now talk a little bit about the situation facing our long-term care homes. The stories of what's happening right now to residents and their families are absolutely gutting. We were assured by the province that an iron ring would be put around our LTCs to protect our residents, but we know that hasn't been enough. Frankly, I'm frustrated, and we need more to be done to protect those who are the most vulnerable in our communities. The province needs to immediately find a solution to ensure long-term care homes have what they need to keep their residents safe. And that means recruiting more staff and offering pandemic pay to attract more workers. In Peel, 22 of our long-term care homes, 14 retirement homes, and 6 group homes are currently dealing with COVID-19 outbreaks among staff, and 6 are in the red category among patients. Across the province, more than 200, or 1/3 of all long-term care homes are in outbreak. Our seniors deserve better. Another measure that can make a difference is ensuring that all long-term care staff who need to can self-isolate and are assured sick pay. Frankly, this has to happen for all workers right across the province. Week after week, the GTHA mayors and chairs have been asking both the federal and the provincial governments to guarantee sick pay, and in particular for temporary and precarious workers. Our medical officer of health has also asked for this. We have passed a motion at the region of Peel. We know that employees at essential businesses, as well as in our long-term care homes, are continuing to go to work while symptomatic because they're afraid of losing their paycheck or their job. This is unacceptable and a glaring gap in the financial supports that have already been offered. I'm now calling on the province and the federal government in the strongest possible terms to please make this happen. We are beginning to see the end of the COVID nightmare, and it's only a matter of time that the vaccine becomes more broadly accessible. So over the next weeks and months, the priority at the City of Mississauga will be ensuring that we have the systems in place to help the broader rollout so residents can get the vaccine quickly and as efficiently as possible. Staff at the City have been directed to identify potential sites that can be used to administer the vaccine. And I'm working closely with my policy team to determine what other available resources we have at our disposal to help support the province, Peel Public Health, and of course our hospitals. I'm also calling on the province to create plans for a mass immunization centre in Peel region, similar to what has been put into place in the City of Toronto to help with the timely rollout of the broader vaccination program. We know that the faster that the vaccine is administered, the faster the GTHA can reopen with confidence and help spur the province's overall economic recovery. We did hear some great news from the province today as they launched the new Testing Upon Arrival pilot project at Pearson Airport in partnership with the Greater Toronto Airport Authority. This is something I've been calling on, and it will allow travellers to voluntarily receive a test when arriving at Pearson, providing that extra layer of protection against spread of the virus. This will help health authorities identify COVID-positive individuals arriving in Canada and also monitor those individuals to ensure proper isolation procedures are being followed. As the mayor of the city that hosts Pearson Airport, this is something that I've been calling for. Travellers will now be able to voluntarily receive a test when they're arriving at Pearson and receiving their results within a 24 to 48 hour period. Along with the new testing before departure protocol, this will help health authorities identify COVID-positive individuals arriving in Canada and monitor those individuals to ensure proper isolation procedures are being followed. What we now need is the federal program to work with the province and add a third test to this pilot, which could lead to a modified quarantine protocol. I do want to shift gears now to talk directly to our small business community. I've spoken to many of you over the last several weeks and months, and I can only imagine how disheartened you are about the current situation. We know that small businesses were never a significant driver of the virus, and it's absolutely unfair that small businesses remain closed and to in-person shopping while the big box stores continue to sell non-essential items. The only thing I can tell you right now is that I will continue to advocate on your behalf to all levels of government. I've already started meeting with different small business groups, and I will continue to do so over the next few weeks to ensure that the city and my office are able to fully support you. Before I bring up Dr. Lowe for his update, I want to thank the residents of Mississauga for continuing to listen to the public health advice. I recognize just how frustrated many of you are that we are not seeing the progress that we had hoped for. I'm not going to sugarcoat this situation. It's simply awful what everyone has gone through. And I know it may seem like a lot of effort that we are doing for very little results. But I firmly believe that if you weren't making the sacrifices you continue to make, the situation facing the region of Peel and the city of Mississauga would have been much worse. Your sacrifices are not in vain, and I want to thank you, all the Mississauga residents. And now, I'd like to bring up Dr. Lowe to the podium for his brief update.
Thank you, Madam Mayor, and good afternoon. As of noon today, Peel Public Health has investigated 14,982 cases of COVID-19 in the city of Mississauga. 1,238 are active, 13,437 have resolved, and 307 residents have passed away. Mississauga's current weekly rate is 162 per 100,000, which is slightly up from 150 per 100,000, and test positivity is at 10.5%, which is up from 7.9% last week, reflecting lower testing volumes over the holiday. I do want to say thank you to the Mississauga residents who followed the advice and guidance of public health and stayed home and celebrated with their immediate families over the end-of-year period. However, like many other places in Ontario, Peel is starting to see a surge related to holiday gatherings. So even in this new year, 2021, I must be clear. We must continue to limit our in-person interactions outside of our home. We must bring COVID-19 under control in our community. To succeed in 2021 and defeat COVID-19, we must come together to do two things: keep transmission as low as possible and get vaccine coverage as high as possible. In keeping transmission low, consider this. If we can crest this wave here and bring it down on the other side, we can protect our most vulnerable, our elderly, our essential workers, and our frontline healthcare workers and first responders. We can increase the likelihood of success of the vaccination campaign with fewer chains of transmission to break as vaccine coverage rises. And we can return to normalcy earlier with a lower absolute decrease to get rates under control. If rates continue to climb, it takes a much longer time to come back down. So it's imperative that we do this. Stick to the precautions, stay home, stay apart, limit your interactions as much as possible and only to the most essential with precautions. Don't hold social gatherings, don't attend social gatherings, and please don't invite others into your home, even if they're family or someone that you love. We also absolutely need supports for those who cannot reduce their in-person interactions owing to their work or their living circumstances. While we are bringing more voluntary isolation centers on board, we need to do more. We need paid sick days. We need worker protections for temporary and agency workers. We need sensible policies that ensure that if people fall sick with COVID-19, they can do the right thing, self-isolate, and stop spread. Now, in getting vaccine coverage up, we have started our journey to vaccinate our community. We are currently in phase 1 of the province's framework for vaccine rollout. That means current supply is limited, and the province has prioritized this being delivered to the most vulnerable and those that serve them, long-term care, patients, and their providers. This is welcome relief to these sectors that have been hard hit and weary. Peel Public Health was one of the first health units in the province to receive and deploy the Moderna vaccine into our long-term care homes. Our initial deployment took place over New Year's weekend, and we are now on track to vaccinate all of our long-term care home residents and on-site staff with every home in Peel to be given access to vaccine through this week and into early next. We are aiming to move as quickly as possible to offer critical protection to these most vulnerable members of our community. And together with our hospital partners, we also continue to deploy vaccine to more and more groups within our area hospitals, and I'm grateful to all our partners for their tremendous work and collaboration. I want to finally say that I'm grateful to our community for keeping transmission down as much as can be done as the vaccine comes online. While this is a new year, we are still far from being done with COVID, but fortunately, we know that what we must do to succeed is to bring this under control and give our vaccine rollout the best shot at interrupting transmission. As the darkest days of the year turn ever brighter, so too will our fight against COVID-19 bring more promise in the months to come. So let's do this. Thank you, and I'll pass it back to Madam Mayor.
Thank you, Dr. Lowe. And now I'd like to invite Sam Rogers, our Director of Enforcement, up to the podium for a brief update. Thank you.
Thank you, Mayor Crombie, and good afternoon, everyone. I'd like to begin by thanking all residents in the city for their cooperation over the holiday period, and in particular on New Year's Eve. Public compliance was excellent, and there were no significant incidents, such as house parties, large house parties, or open bars and restaurants. Over the past 2 weeks, a total of 36 charges have been laid, and since the lockdown began on November 24th, a total of 198 tickets, 10 Part 3 summons, and 135 notices of contravention have been issued. We've seen violations across many sectors, but the most egregious violations have been privately held gatherings in commercial spaces. These violations have typically consisted of 10 to 20 people. They're usually in small commercial plaza units that are closed to the public with the windows covered and doors locked. Most occurrences have involved a mix of table games, alcohol, and smoking. Over the past 2 months, there have been 10 of these occurrences in 8 separate locations throughout the city. Each time, we have strictly enforced the regulations alongside Peel Regional Police, Peel Public Health, as well as the Alcohol and Gaming Commission of Ontario. In total, we have laid 105 charges for those 10 occurrences. This should be taken as a strong message to anyone involved in these types of gatherings. We will continue to proactively monitor and strictly enforce the regulations, so please don't participate. Other than a few bad actors like these, I'm pleased to share that overall businesses have continued to show excellent levels of compliance. We've conducted thousands of inspections, and the compliance rate has remained consistently high at 99%. I'd also like to note that we are proactively inspecting all businesses, including big box stores. They have been very compliant with the new capacity regulations, and I'd ask that residents Observing any type of violations, continue to report matters to 311 and we will investigate. Overall, I'd like to thank all businesses for their ongoing cooperation during this most difficult time. In closing, I'd like to thank our frontline enforcement officers, Peel Regional Police and Peel Public Health for their outstanding joint enforcement efforts. They all have extremely difficult jobs, and their resilience, professionalism, and dedication to this city cannot be understated, so thank you. Now I'll hand it back to Mayor Crombie.
Thank you, Sam. Whoops. And now Sam and Dr. Lowe and I are prepared to take questions from the media.
Mayor Crombie, your first question comes from Stephanie Marotta from the Globe and News.
Hi, thank you so much for taking my question.
Welcome, Stephanie.
Thank you. My question is for both you, Mayor Crombie, and Dr. Lowe. So there's been quite a bit of discussion in Peel about how contract and temp workers are particularly vulnerable. And for some time now, Peel has been calling on the province to provide greater supports for precarious workers. So what do we know about how temporary workers are affected and how many have been infected with COVID? And further to that, what is your reaction to the province's response to your ongoing calls for more support for workers?
So let me just share with you that I did receive a call from Minister of Labour Monty McNaughton, and we had a very fulsome conversation on how I thought that program could be delivered and better enhanced. And he very strongly felt that it was a program that was best delivered by the federal government under the current EI system. But with respect to the numbers of how many precarious workers, temporary workers, contract workers who have now contracted COVID and not self-isolated and not been and not had the benefit of any sick pay. Maybe I'll pass that on to Dr. Lowe. Thank you for the question, Stephanie. It was a very good one.
Yes, thank you, Madam Mayor. Thank you so much, Stephanie, for the question. I want to be very clear. Data on temporary and agency workers, specific in terms of numbers, is actually quite limited at this point in time. And I've been very grateful for a collaboration that we've had with the South Asian Task Force and specifically with Dr. Amanpreet Brar, who has actually provided us with qualitative data through interviews with temporary and agency workers that indicate all sorts of barriers in order for them to protect themselves, both in respect of getting tested, in respect of accessing care and accessing supports when they're self-isolating, and also in terms of accessing, assistance and information around how they can keep themselves safe while they are at work. So this has, we in terms of the numbers and the data, we continue to be collecting those pieces. We're aware of the issue, but we do know that whatever numbers we do have are challenged by the fact that many of these people are falling through the cracks. We know that, like I said, they're not even getting tested, but they may be sick with symptoms consistent with COVID-19, again, because of the need and that really devilish balance between, making sure that they're able to keep a roof over their heads, making sure that they're able to keep food on the table, versus staying home and self-isolating and doing the right thing, but risking losing that all. So the data is really scant in terms of quantitative numbers, but in qualitative numbers, thanks to our partners at the South Asian Task Force, we do know that this is a significant problem in the community, which we are continuing to explore further. Thanks for the question.
Follow-up?
Yes, I'd be remiss if I didn't ask again about transparency on naming workplace outbreaks. So far, Peel has said that it would name businesses if there were a greater risk to the public, such as needing to be able to do contact tracing. And this week, Toronto decided to start naming businesses and outbreaks where there are a high number of cases or evidence of sustained transmission in the workplace. And Hamilton has been disclosing since the spring. And this morning during Brampton's presser, Mayor Brown mentioned that Dr. Lowe is looking at Toronto's new policy to see if it should be applied in Peel. So for both Mayor Crombie and for Dr. Lowe, are you looking into considering disclosing names of workplace outbreaks in certain cases, and why or why not?
Stephanie, thanks again for the question. It's a good one. It's one we've been grappling with, and certainly we're happy to disclose the name of any company that is front-facing and poses a public health risk. but up until now that has not happened. As you know, we need the cooperation of those companies so that we can better conduct the contact tracing and so not to stigmatize them further. I think that Toronto also matched some of our reporting indices when they're now posting on their dashboard, as we have been doing for some months, the sectors like the industrial sectors and industrial settings, manufacturing, etc., that have had outbreaks. So you can track on our dashboard and have been able to for some time where those outbreaks have occurred in which sector, and certainly Toronto will be now following our lead in doing so. But with respect to automatically releasing the names of the companies, I'll leave that to Dr. Lowe because, of course, that is his policy. Thank you, Stephanie, and I'll welcome him to the podium now.
Yes, thanks, Madam Mayor, and thanks, Stephanie, for the question. Just to clarify, this is not necessarily my policy per se, but it is standard practice in many public health agencies in Ontario as well as throughout Canada that where a workplace outbreak an investigation identifies a risk to the public or where contacts need to come forward for tracing, certainly we would always disclose the name and the location at which the points of exposure may have occurred. I think the whole disclosure discussion can be boiled down to one thing, which is really a goal that I share and that public health shares. It's about the safety of our community and it's about the safety of our workers. And so in thinking about the question of how broadly to disclose and the nature of disclosures, certainly privacy is something that is talked about at length in the media, but we also know there are other reasons why the policy exists in the manner that it does. At this point in time, with our current policy, we are able, and also the Section 22 order that we put in place in workplaces, which was essentially the first in Ontario in November in recognizing our problem here in Peel. With our current policies in place and that Section 22 order, we receive tremendous compliance and cooperation from companies that are in outbreak, which allows us to actually get in there more quickly, to identify areas and points that action need to be taken, and to stop spread sooner, to keep workforces and our community safe. So, certainly it has been working for us at this point in time. The magnitude and the number of outbreaks that we have in our community really reflects our employment profile and just the sheer number of industries where people cannot do work from home. And it is not a reflection on the fact that it's not a reflection on the response and the ability to respond. And one of the things that we do know is that if we do start to broaden the nature of disclosure, some companies may not necessarily want to participate, and then that would jeopardize worker safety and our community safety in an outbreak. So it's a fine balance. It's one that we continue to work with, and certainly in seeing Toronto provide additional specificity around how they would define a risk to the public, we will continue to study that, and should our processes need a revision, we would certainly do so in the interest of protecting our community. Thanks for the question.
Your next question comes from Steve Cornwell at the Mississauga News. Go ahead, Steve.
Hi, Steve.
Mayor Crombie.
Hi.
Happy New Year. How are you?
I'm well, thank you. I hope you are as well.
I am, thanks. Thanks for the update today, and you outlined some of the concerning numbers from long-term care facilities in Mississauga and Peel today, and you'd asked for as much as possible help from other levels of government to kind of make sure that everything is being done that can be done for these facilities. I'm just curious as to, obviously there has been a precedent set for the military coming in at some time in these long-term care facilities, even in Peel region. I'm just wondering why, if there's any specific reason you didn't specify that form of help in this case.
Thank you. I limited my recommendations to hiring recruitment of additional staff, additional PSWs, nurses, workers in our long-term care facilities, in our seniors' homes. I know that many of the homes are in outbreak and they are experiencing staff shortages. And in addition, I highly recommend that we offer the pandemic pay. Those are the people who are being most greatly affected by the COVID virus. So with respect to asking the military to come in, I'm not sure that any of our congregate settings are in that dire a need currently. You know, if there was one, perhaps Scarborough Tender Care, but I'm not at that point yet. But should we meet that threshold, I wouldn't hesitate to make that ask. So why don't I ask Dr. Lowe if he thinks it's necessary that the military come in and provide further assistance to our congregate settings. Thank you, Steve.
Yes, thank you, Madam Mayor, and thank you, Steve, for the question. As I understand it, at this point in time, our integrated response team continues to respond to outbreaks in long-term care homes, and as you know, in a partnership together with Ontario Health and with paramedics and with long-term care home administrators in our hospitals, are able to, at this time, address the outbreaks that currently exist. Certainly, if there are additional requests or needs for assistance, that would be something that I imagine the integrated response team would highly consider. I think the more important message that I would have to everyone there is the iron ring and the precautions that were put in place. Those are not necessarily fail-safe, and at the levels of transmission that we have continuing in our community, you throw enough stuff at our long-term care homes, and unfortunately, something is bound to get through. So it really speaks to the need for everyone to follow the precautions, reduce the rates of transmission in our community, and also for those supports to come in for people who can't do that voluntarily, to make sure that we give both our long-term care homes the help they need to ensure the precautions work, and also our vaccine program the best shot at succeeding. Thanks very much.
Follow-up?
Yes, thank you for that. And Mayor Crombie, I spoke with a lawyer today from the Canadian Civil Liberties Association, just generally about some of the, the challenges of enforcing these public health measures in Peel, and her comment was basically it's tough to police your way out of the pandemic. So I'm just curious, in some ways, on one hand, like how do you for these, and I'm happy that Sam Rogers is here. Maybe you can just speak to it as well, but. In some ways, how do you think that the COVID enforcement efforts so far by the city have been effective in deterring people from breaking the rules and ultimately lowering case counts?
I'm going to ask everyone to respond, but let me start out by saying, even in the proactive inspections that our enforcement team has done, they have found 99.7% compliance. The vast majority, other than 0.3% of Mississaugans, are following the rules. They are complying to the guidelines, and I'm very, very, very proud of them. Everyone is on the honor system, and I think that has borne out fruit that our bylaw does go out not only in response to 311 calls by neighbors and people concerned about noise complaints or too many cars at a residence or whatever it might be, but also in their proactive inspections. I know that they often attend at the big box stores, shall we say, when they hear that they're over capacity and make those inspections. And they're working very closely with all the head offices so that to ensure that there is compliance and that everyone is following the rules. I think by and large, Steve, Mississaugans do follow the rules and want to, and they are very concerned about their own loved ones. And so when they see other people breaking rules, they don't hesitate to make that call to say, look, all of us have to follow the rules. You have to do your part too. All of us have to do our part. So that's why I think we see a very high level of compliance. But why don't I ask Sam to come in and address that from bylaw inspection point of view, enforcement point of view here at the city, and then Dr. Lowe maybe on the inspections that public health has done as well. All right, over to Sam.
Hi, good afternoon, Steve. So just a couple of points to build on what Mayor Crombie shared earlier. From a deterrence perspective, very difficult to determine, what hasn't occurred. And Mayor Crombie made comments earlier about being convinced that had we not had the measures we do in place, the situation would be much more dire. I can tell you from, a key measures perspective, we track public complaints, we track our tickets, and we track our number of inspections and the compliance rate Mayor Crombie also spoke to. Things have been relatively stable and from a public complaints perspective. I'll tell you what's increased an awful lot has been the number of tickets we've written, and that's really been a reflection of what our message has been, is that we are getting much stricter on the enforcement of the regulations on this new lockdown since November 24th. But offset with that is the higher compliance rates, and we have done thousands and thousands of inspections. Vast majority are in compliance. We've really gotten efficient at identifying who those bad actors are. We've stayed on top of them, and the charges have reflected that as well. So those will be my comments, and I'll hand it over to Dr. Lowe.
Yeah, so thanks, Steve, for the question. Thanks, Madam Mayor, and thanks, Sam. I'm glad you asked this question, Steve, because it actually allows me to also return the thanks that Sam mentioned in his remarks to certainly our bylaw enforcement, and also thinking of all of our police partners, and in terms of the enforcement that's been taken out around the public health measures. I'm going to speak more. So first of all, Peel Public Health certainly has enforced in certain food premises that have remained open or that continue to remain open in defiance of the regulations, and certainly work in concert with our bylaw and police partners, depending on the nature of non-compliance that is occurring within the region. But I want to speak more from the broader perspective, which is that a certain amount of non-compliance is regrettably expected when it comes to public health recommendations. It's just that the stakes are much higher now, and this is why I implore the community, please stick to the rules. I often tell my students, and I often say, every year public health tells people not to do certain things. We ask people to, not smoke. We ask people to not have, not drink and drive. And yet every year people will do that. And unfortunately, enforcement, despite, their very best efforts and everything that we can try to do, we're not going to get them all. And that's why we're still sort of seeing spread in certain circumstances. Certainly we're seeing spread related to the essential workers and the disparities, but there is a certain amount of discretionary interactions that are still happening in our community and did happen over the holidays. So if I can't underline the point, finally enough, please follow the recommendations, limit your contact interactions. Enforcement really should be for, an absolute last resort. But the idea is that if we're trying to get these cases down, it is going to take all of us to ensure that we succeed. Thanks very much.
Dr. Lowe, the next two questions are for you, actually, so you can stay there. They're from Isaac Callan at the Pointer. Go ahead, Isaac.
Dr. Lowe, Happy New Year.
Happy New Year, Isaac.
Thank you. I want to ask first about the grey lockdown, just looking at the cases, and you mentioned, I know there was a bit of a plateau, but cases haven't really gone down at any point since they started to rise. And previously we were going up through the gears, sort of increasing the restrictions as the cases increased. And we've now reached a point where we've been in the grey lockdown for quite a while. And I'm just thinking about the Section 22 order you issued for workplaces, the brief point where we were in the red zone, and you put in some additional measures as well. What I want to know is your toolbox empty at this point for Peel Region? Are you relying on the province to make things stricter, or do you have some power left to tighten things a little further if you feel the need?
Well, Isaac, at this point in time, we're in the midst of a province-wide shutdown. So certainly we're aiming as much as possible to collaborate with our provincial partners in recognizing the desire for a uniform approach across the province of Ontario. But no, I mean, certainly there remain the same tools. So, Section 22, letters of instruction as needed. And should we identify a specific measure that may need to be taken in the community, then, I would not hesitate, and the need based on the data, I would not hesitate to use those powers to ensure that our community is kept safe.
Thank you. And then my second question is about Appeals Elementary Teachers Union, which has issued a letter today asking basically for schools not to open as they're currently due to. They don't think it's safe. And I know that schools themselves, again, it's a provincial decision, but you are really the eyes and the ears of the medical community and the province's eyes and ears to an extent in Peel as well. So I just want to ask your opinion as the local medical officer of health, if you think it's safe for elementary schools to return, or if you would back that call by the union to delay and move to online learning for a while.
Thanks so much for the question, Isaac. I think I want to highlight, first of all, that in general, schools have not been seen to be a significant focus of transmission. However, similar to long-term care homes, when you do get to community rates at the level that we are, we do know that there is more and more introductions, and therefore, a slight increase in risk in that sense. But overall, based on the data that we've had in this point in time, we've not had significant massive outbreaks within schools that have been identified through the course of our investigations. But I want to make very clear in terms of the question that's raised by the ETFO and Peel that this is a subject of extremely active discussion between ourselves, other health units, and our provincial counterparts. And I think the only thing that I can state is that, as you've noted, we are currently at a plateau similar to the situation prior to the holidays, which is certainly something that is factoring very closely into any decision or recommendation that I plan to render in the days to come. Thanks very much for the question.
Next question comes from Ashley Newport at Mississauga. Go ahead, Ashley.
Hi, Mayor Crombie.
Hi, Ashley.
So I wanted to get your thoughts on earlier today, and I think this has been mentioned over the last 2 times that the Premier has made comments, but today when the Premier gave a press conference, he was asked a few times if he's considering following in Quebec's footsteps and considering something more stringent like curfew. I was actually wondering what your thoughts are on that, if you think that a curfew would work and how the city, should be proposed, how the city and enforcement would handle that. Is it something that you're concerned about or thinking about in the event that one is implemented, especially since it's so unprecedented because we didn't even have one back in March, but it seems the numbers are stubborn, so it seems like this is something that's now on the table, as he says. So yeah, I just wanted your thoughts on that.
So thank you for the question, and perhaps I'll also ask Dr. Lowe to respond, since he's the medical expert and we take all our advice from him with respect to enhance or additional restrictive measures. Certainly, I hadn't given a lot of thought to a curfew, Ashley, I'll be honest. I think that in the lockdown that where we're in now, we've asked people to stay home and only go out for the essentials. And there are certainly essential workers who do go to work into factories and processing plants, etc., fulfillment plants each and every day, who may not have the opportunity to do their grocery shopping until after whatever the curfew hour may be. So, I don't know. I'd have to give it some more thought, Ashley. I don't think at this time I would support it. We are just generally asking people to stay home and go work from home when they can and go out for the essentials. So Dr. Lowe, if you'd like to speak to additional measures you would consider putting in place, and we take our advice from Dr. Lowe. Ashley, thank you.
Yes, thank you, Madam Mayor, and thank you, Ashley, for the question. Certainly would respect any decision that would come from the Premier's office, and certainly I would say at this point I think been made very clear, and certainly in my conversation with Isaac just recently, previous to yours, it's clear that there is continuing a plateau of our cases in our community. And the question that we then need to ask ourselves is, to what extent can we continue to bring that down to assure the success of our vaccination program, to protect our hospitals, which are certainly overcrowded in capacity, and certainly to protect our long-term care homes, which are seeing increasing outbreaks. I think whatever is on the table and being discussed at the provincial level is something that we will hopefully have input into and hopefully be able to provide our community perspective into. But I think I've been very clear about what are some big things that we need to do, especially supports for essential workers, temporary and agency workers, paid sick days, all those things that actually would help to encourage testing, encourage those individuals to get support, and make sure that they can do so with the confidence their job is protected, as well as additional measures that may need to come in to ensure that people are getting the message around the idea that we need as much as possible to limit our interactions outside of our homes. Thanks so much for the question, Ashley.
Follow-up?
And, and my follow-up is actually for Dr. Lowe.
Sure.
Yes, okay, sorry, I'm back.
So I kind of wanted to follow up on Isaac's question actually about schools. I know that the union is calling for school closures to be extended And I know you said that that's something that's being discussed right now, but I'm actually wondering if you're planning to do more about potential school transmission, such as rolling out more asymptomatic testing in certain schools, and if you're going to maybe target certain neighborhoods more than others. Do you see doing more testing in schools to try to maybe get a fuller picture of whether or not schools are maybe contributing more to transmission than initially thought?
Yeah, the short answer is absolutely. I think, that we've already done that at 9 or 10 different schools in the region of Peel. I'd have to double check with my school lead to get the exact number for you. But certainly when schools reopen for in-person learning, asymptomatic testing will continue to be one of the tools in our toolkit that we would look to deploy into those facilities to ensure that it remains a safe learning environment for students and also to keep our community safe. Thanks for the question.
That wraps up all our questions for today. I thank everyone for joining, and we'll see you next week.
Thanks very much, everyone, for joining us.